Ever experienced a gum ache that seems to intensify after teeth cleaning? Here's a quick run-through of 10 potential issues that might be causing this. 1. Aggressive brushing or flossing could lead to gum sensitivity. 2. Using a hard-bristled toothbrush might be the culprit. 3. Gum disease or gingivitis could also be the underlying cause. 4. Tooth decay near the gum line is another potential issue. 5. A misaligned bite or grinding your teeth can intensify gum ache. 6. A reaction to certain toothpaste or mouthwash ingredients can trigger sensitivity. 7. Hormonal changes, especially in women, can affect gum health. 8. Certain medications might cause gum discomfort. 9. Nutritional deficiencies can lead to gum issues. 10. Sometimes it's as simple as a piece of food lodged between your teeth. To prevent these issues, maintain good oral hygiene, use a soft-bristled brush, and don't forget to visit your dentist regularly. Remember, knowledge is the first step to better oral health and well-being. For more insights, stay tuned.